Good day. My name is Adam Sinswat. I am a computer programmer 1 at the Department of Health Center for Health Development. I will teach you how to use the Integrated Clinic Information Systems Prenatal Consultation, Part 1 of the MCP process. This tutorial assumes that you already know how to set up the iClinicSys. Log into the system and go to the Electronic Medical Records page. Before adding a new patient, make sure to try searching for their name first to avoid duplicates. Typing their first name or last name will suffice. Click on the search button to begin searching for the patient. Since the search gave us 0 results, we can now go ahead and register the patient to the system. Click the Add New Patient button. Before we begin encoding the patient demographics fields, let's first begin by adding the profile picture of the patient. Click the webcam button near the profile picture. Make sure you have set up a webcam device if you're using a desktop, or if you're using a laptop, make sure your laptop has a built-in working webcam. Once you're ready, click Take Snapshot to take the patient's picture. Click Save to use the picture taken for the patient's profile picture. Encode all the data that has an asterisk beside an empty box. If you set the civil status to married, then you will need to type the patient's maiden last name and maiden middle name. If you set the employment status of the patient to employed, make sure that the patient knows their employer's PIN or PhilHealth employer number. This will be used later when submitting e-claims forms. Make sure that the zip code is correct. This will be used for the household profiling function of the system. Select Head of the Family if the patient is the one leading the family. Otherwise, select Mother. If the patient is a DSWD NHDS member, then select the Yes option. Click the magnifying glass on the right side of the Family Household Number box. Here is where you search for the facility household members of the patient. Click either the name or household number to use that for the patient, or you can instead click Generate New to create a new facility household number. Encode the household number of the patient. Repeat the steps done with the family household number for the family serial number. For the PhilHealth member question, if you select yes, you will need to encode the following details shown on screen. If you select the PhilHealth member type of dependent, you will need to encode the following details such as relationship to member, the member's last name, first name, middle name, birth date, member suffix, and sex. The PhilHealth dependent number is optional. For the PCB eligible question, if you chose yes, select the date the patient applied for primary care benefits package. If they don't remember, then just select the date the patient visited your facility. The enlistment date indicates the date the patient enlisted for the PhilHealth membership. If they don't remember it, then use the date the patient visited your facility. Click Submit once done. For the next step, we're going to add a new prenatal consultation. Click the Add New Consultation button. In the type of consultation/purpose of visit, click on the prenatal category. Click on the calculator icon near the patient height section and encode the feet, then inches to automatically convert the value to centimeters. You can also repeat the same steps for weight if you need help converting pounds to kilograms. Once you've typed the patient's height and weight, the BMI category will automatically be calculated. Usually the height for age and weight for age will also be calculated, but if it isn't, you'll need to manually select the correct option. In the chief complaint box, type the complaints the patient is having with his or her condition. Make sure to select the Yes option for the patient consent, otherwise you will not be able to save the consultation data. You can also have the patient read the consent form. Click Submit once done. This concludes the consultation process. The next topic to be covered will be in 5 parts discussing the basic services: vital signs, physical exam, system review, doctor's order, and consultation status. Part 1 of the basic services process is the vital signs. Click on the Vital Signs button to begin. Then click on the Add New Vital Signs button. Type the value for the blood pressure systolic, blood pressure diastolic, respiratory rate, body temperature, heart rate, and choose whether the patient has a normal rate and regular rhythm. Type the value for the pulse rate, oxygen saturation, time when the vital signs were taken. BP measurement assessment, whether hypertensive or non-hypertensive. I'll select non-hypertensive as an example. Then add remarks you may have found. Click Submit. Click back to consultation to return to the consultation page. Part 2 of the basic services process is the physical exam. Click the Physical Exam button. Click Add New Physical Exam. The remarks boxes you see can be left empty, so long as the preceding section has an option selected. For example, if the abdomen section has an option selected, you can leave the abdomen remarks empty. However, if the empty boxes don't have any options before it, you will need to type the findings in it, or if there's no findings, just type essentially normal. Only the Others section is exempted from this. Click Submit once you're done. Then go back to the consultation. Part 3 of the basic services process is the system review. Click the System Review button to begin. Click Add New System Review. I'm just going to go ahead and encode all the data required. Click Submit to finish the process. Then go back to the consultation page. Part 4 of the basic services process is the doctor's order. Click on the doctor's order button. Then add a new doctor's order. Select the laboratory request and imaging requested by the doctor for the patient. Select the correct type of diagnosis. If this patient will be availing of e-claims, then you need to set the diagnosis to final. Select the correct ICD code. You type in the search box to filter the results. Prescribed medicine is self-explanatory. Click Prescribed medicine. Select the reference place you would like to search the medicine from. Usually the All Drugs category will suffice. But if you can't find the medicines there, you may need to search for it in the inventory drugs, but you will first have to manually add the medicines in the Logistics Management module's inventory list. If you selected All Drugs, click Search Commodity Medicine to search for the medicine. Type the generic name of the drug in the search box to filter the results. Click on the drug code on the right to add that medicine to the prescription. Now type all the details needed for each empty text box like dose regimen, total quantity unit of measure, like 500 milligrams and such, intended purpose of the medicine, medication can be left blank, and lastly, the doctor or pharmacist for the prescribed by field. But it is highly recommended to choose the doctor by default. Click Submit once you're done. If you click the checkbox on the left side of the medicine record, you can create an electronic prescription that you can print. You can add another medicine by clicking the Add New Prescription button. Once you're all done, click the Submit button to finish the process. Click the lab result link to view the laboratory request results. If you selected more lab requests, they will appear in this dialog box. Only fill up the empty boxes that matter. What I'm typing is just sample data, so don't mind it too much. Make sure you have already added the medical technologist in the system in order for them to appear here. Click Submit once done. If you click on the form link, you will generate an electronic form of the laboratory result, which is printable. You can repeat the same steps with the imaging request. Click back to consultation. Part 5 and the last of the basic services process is the consultation status. Click the consultation status button to begin. Click Add New Follow-ups to add a new consultation record. Select between the two consultation status, completed and incomplete. Then if there are any remarks, type them in the follow-up remarks. This concludes the basic services transaction process. The next topic we will discuss is the prenatal FHSIS process. Click on the prenatal button under the FHSIS services category. Click Add New Folder. Encode all the data required. Make sure all the text boxes that have a red asterisk are not left blank. Click Submit once you're done. Click the magnifying glass icon to preview the prenatal folder. Click the pencil icon to edit the prenatal folder. After doing any changes, just click the Submit button to update the changes. All these steps I've taught you are for the initial prenatal consultation. You're going to keep adding new prenatal consultations for pregnant patients every time they visit your facility until they have given birth. Let's pretend that Ms. Della Rosa returned for her next prenatal checkup. Any prenatal consultations after the first one must be a follow-up visit, so set the nature of visit accordingly. Repeat the steps for the basic services up to the FHSIS services for prenatal. The next consultation I'm going to demonstrate is one where the patient is about to give birth. Just like before, complete the 5 basic services and fill in the prenatal FHSIS service. You'll notice that the prenatal folder is grayed out. Simply click on it and press OK to proceed. Clicking OK will allow the prenatal folder to carry over the last encoded prenatal folder's data. Edit the prenatal folder and set the date of delivery. More fields will become available after encoding the date of delivery. Please provide the needed information as seen on the screen. Since the pregnant patient has given birth to the baby, We will now set the case status to inactive, signifying the end of the prenatal consultation. Click Submit when you're finished. Click on the prenatal folder again. There's one last step we have to complete, the pregnancy outcome. You have to set the patient's pregnancy outcome in this part. If you want to know the process, kindly skip to the timeline shown on screen. We're now going to tackle providing additional data for the prenatal folder. This step in the system is optional and depends on your OB's recommendation. Click on the prenatal button under the FHSIS services. Click on the prenatal folder. You'll notice that there's additional forms on the right side of the screen. You'll see there are forms for supplementation, abdominal, disease surveillance and screening, birth and emergency, pregnancy outcome, CTG, partograph, and danger sign. Let's start with supplementation. Click on the Add New Supplementation button to begin. Provide the necessary information. Fields with a red color are required for submission. I'm going to go ahead and encode sample data. Click Submit once you're done. Click on the pencil icon if you wish to edit the form again. You can do this to almost any form after this one. Next is the abdominal form. Click Add New Abdominal Examination Findings. Provide all necessary information on the empty fields. What I'm going to type is only an example. Click Submit once you're done. Click on the Summary button to view the Abdominal Examination Findings Summary. Next is the disease surveillance and screening. Click Add New Surveillance and Screening. Then provide all necessary information. Click Submit once you're done. You can opt to add more by clicking the Add New button. Next is the birth and emergency. Click on Add New Birth and Emergency Plan. Encode all necessary information. I'm just going to go ahead and type some sample information. Click Submit once you're done. Click on the form link to view the birth and emergency plan form. You can change options for fields with an empty circle, such as the "I have set aside money for newborn screening" statement. Next step is the pregnancy outcome. Click on the Add New Pregnancy Outcome button. Provide all necessary information. I'm going to type sample data. I recommend you select the Add as New Patient option, so the baby will be automatically added into the system. You can also set the baby's name as baby boy or baby girl as placeholder names while the parents have not decided on a name yet. Click Submit once you're done. Next step is the partograph. Click the Add New Prenatal Partograph button. Provide all necessary information. I'm just going to type some sample data. Click Submit once you're done. Last step is the danger sign. Click on the Add New Prenatal Danger Signs button. Select the type of danger sign, then click Submit. You can add as many danger signs as needed. Clicking on the danger sign summary will show you a checklist of danger signs. This concludes the first part of MCP package consultation process. Part 2 will tackle the postpartum consultation. Thank you so very much for watching. I hope you learned a lot from watching this tutorial. Please give this video a like and subscribe to our channel. ICT Unit DOH-CHD RO12 for more videos about DOH Region 12's information systems.